Close your eyes. Imagine your doctor reaching into a kitchen drawer for an ordinary ice pick and a mallet. This isn't a fever dream. This was once marketed as cutting-edge medicine, sanctioned, celebrated, and even rewarded by the Nobel Committee. It began in Portugal. Dr. Antonio Egas Moniz believed severe mental illness was the result of fixed neural pathways. His solution wasn't to heal them, but to sever them. He used a steel wire loop instrument called a leucotome, and the procedure became known as leucotomy. The idea crossed the Atlantic. On September 14, 1936, an American named Walter Freeman performed one of the first such procedures in the United States. But the traditional method, drilling into the skull, was too slow for him. Freeman didn't want surgery. He wanted a production line. While Freeman was refining his approach, the world watched in awe. In 1949, Egas Moniz received the Nobel Prize in Physiology or Medicine for the therapeutic value of leucotomy. The scientific establishment had effectively given its blessing. For Freeman, it was the ultimate green light. If it was Nobel-worthy, then doubt had no place in the operating room. By 1946, Freeman had found what he considered the perfect shortcut: the transorbital lobotomy. The protocol was brutally simple. First, the patient was shocked with electricity until they lost consciousness. Next, Freeman took his tool, at first a literal ice pick from his own kitchen, and positioned it under the upper eyelid. Then, a sharp strike drove it through the thin bone behind the eye and into the brain. Finally, a quick wrist motion, left, then right, was used to disrupt the frontal lobes, areas closely tied to personality and judgment. Minutes. No stitches. Sometimes barely a trace of what had been done. Just a person who might never be the same again. There is one name in this story that still stops people cold: Rosemary Kennedy, the sister of a future U.S. president. She was described as too emotional, too unpredictable, too inconvenient for the Kennedy image. In 1941, her father, Joseph, brought the 23-year-old Rosemary to Freeman. Accounts describe Freeman asking her to recite or sing while he worked, continuing until her voice began to fail. When it was over, Rosemary's life was permanently altered. A woman who once loved to dance and live was left profoundly disabled. She spent decades in institutional care, separated from the world she'd known. Lobotomy didn't remain rare. It became a trend. It was prescribed for depression, insomnia, anxiety, even teenage rebellion. In the United States alone, more than 40,000 procedures were performed. Freeman personally carried out roughly 2,500. He documented before and after photos like trophies. His youngest known patient was reportedly just 4 years old. Freeman didn't always need a careful diagnosis. He needed the wards quieter. It wasn't until 1967, after a patient died from a brain hemorrhage, that Freeman was finally barred from surgery. But by then, the damage was already widespread. And the Nobel Prize? It was never revoked. To some, it remained an achievement. To history, it remains a warning. We're taught to trust white coats. But remember this: sometimes progress doesn't smell like a sterile hospital. Sometimes it smells like kitchen-grade steel.
Just relax, everything is going to
Your
be fine.
freedom of thought,
I'll just step
your
behind the
will,
screen here.
your tears, your laughter, all of it was once treated as a problem that could be fixed with a single strike. This is Medical Dark Files. Protect your mind. Some secrets were meant to stay behind locked operating room doors.